Hi all. Welcome to Oet Speaking and Writing. Today we can discuss some useful tips for Oet speaking. You can easily get B score if you focus on basic things and follow so tried and tested Oet speaking tips. Speaking tips 1. Playing your part. The interlocutor might act as a patient or a client of yours. You will have to play your role. Remember, you will have to speak like a professional and take the interviewer as just one of your patients or clients. Speaking tips 2. Beginning the conversation. You really do not have to take it as an exam. It is rather a medical situation and you will have to deal with it well. You will be in a professional setting and you will be asked to talk to a patient and you will be asked to talk and offer advice as needed. You will have to begin the conversation and make the client or patient more comfortable. Take the patient or client as just one of your patients or clients. Do not think you are talking to the Oet person or the interviewer. This will help you talk more effectively and more naturally. Do not just sit and wait for the patient to begin the conversation. Take the opportunity to introduce yourself and move on. For example, hello, my name is Sarah and I am the community nurse. Can I start with your name, please? Speaking tips 3. Continuing the conversation. You will have to keep the conversation moving. You should not stop the conversation. If at any point in time, the conversation stops and silence pervaded, it will be your responsibility to make it go on again. For instance, you can keep ready some joiners or silence breakers to use as the situation demands. For example, you can say, "Can you give me more information about it? Can you tell me more about it? Is there anything else that is bothering you, which you would like to add?" Speaking tips 4. Do not hesitate to ask questions. The more the number of questions you ask the patient or the client, the better it is going to be better for you. Even if your patient is reluctant to speak, he or she will have to answer the question. Your primary purpose here would be to keep the patient talking. You can ask some common questions depending upon the topic or medical situation given. For instance, you can ask like, "Do you still feel pain? How do you rate your pain on a scale of 1 to 10? How long have you been suffering from this? What are your current medications?" Speaking tips 5. Understand the patient or the interlocutor. You will have to understand what your patient is saying. Try to get as much information as you can about the problem he or she is suffering from and the solution he or she might be expecting to get. When you listen to the patient well, you will be in a position to offer the best advice, suggestions or recommendations. Speaking tips 6. Refining your language. Be humble, be respectful and be distinctively understandable. You certainly do not have to speak fast. Speaking fast is not at all fluency. On the contrary, this can create problems for you. Your interviewer might not be able to understand you well if you speak fast. So, lower down your speed and try to speak more calmly but more intelligently and precisely. Focus on what you are saying and how you are saying it. Speaking tips 7. Be ready for all odd questions. Your interlocutor might ask you some odd questions which may contradict standard medical knowledge. So it is always wise to answer more politely. Do not assume that your interviewer is not aware of what is happening in the modern world. Every now and then the Oet person will test you by asking you something a little odd. He or she wants to see how well you respond, how flexible you are in your thinking and language. For example, what's the phone number of the occupational therapist? What do you do? You give a phone number, or you say, "I will give you the number after our consultation." Speaking tips 8. Organize the role play if you really want B grade. You will have to organize the role play into clear stages with an introduction, body and conclusion. In the introduction, you introduce yourself, welcome the patient and summarize the scenario. In the body, you move through the tasks, one by one. In the conclusion, if you have time, you should summarize the role play by saying, "Hope you understood everything. Thank you all."